All right, it is 11 o'clock and we're going to go ahead and get started. Good morning and welcome to the May EP&R Lunch and Learn on PHEP Capability 6, Information Sharing. Today's presenter is Jonathan Falk, Epidemiology Program Manager, Office of Epidemiology. Over to you, Jonathan.
Thank you, Donald. Good morning, everyone. Today we are going to cover the Public Health Emergency Preparedness Capability 6, Information Sharing. And apologies to those that have attended these trainings before. I am going to, again, cover some background on the Public Health Emergency Preparedness Capabilities. These are national standards for state, local, territorial, and tribal public health. Capabilities, as standards, they work or help strengthen our approach to security and resiliency in the Commonwealth in our preparation for threats that may pose a risk to public health, at least from our focus. And essentially, the goal here is to align with our agency's emergency support function number 8, which is health and medical. And in the last year, I believe VDH has begun to get more involved in the emergency support function 3, which is public works, related to some of the drinking water events that we had to respond to. Ultimately, these capabilities work to guide our program improvements and initiatives and address preparedness and response planning gaps. Those capabilities, which is a standard document that CDC has produced, are divided into 6 domains, and there are 2 different tiers. Capability 6, information sharing, falls within the information management domain, and it is a tier 1, which is sort of designated as foundational to public health emergency preparedness and response. Within each of these capabilities, we do have functions, which are segments or parts of that capability that would need to be achieved in order to attain the definition of that capability. And then within each of those functions, we have tasks that are sort of described action steps to that we focus on trying to accomplish in order to meet that function. Given that, we'll go ahead and dive into information sharing, that capability 6. As a definition, this particular capability is focused on our ability to conduct multi-jurisdictional and multidisciplinary exchange of health-related information, as well as situational awareness among a number of our government partners at the federal and local and state levels, as well as private sector. This is a little bit different than, I believe, capability number 4, which is public communication and warning, which is more external for the public. Information sharing is really more about internally, how do we share this information among other teams, individuals, entities that are part of the response to an incident or event where public health is concerned, at least from our perspective. So with that as our definition, kind of looking at function 1, this initial function begins at the kind of starts as we would expect in terms of identifying which stakeholders should be involved in the exchange of information and kind of defining what those information sharing needs are with those particular stakeholders. Ultimately, the tasks are to identify internal as well as sort of external jurisdictional stakeholders to include as we look at how we share the information, and then periodically update or refine what information we're sharing, what those sharing needs are with those particular stakeholders. So that may take the form of creating rosters of identified stakeholders, what kind of information we're exchanging, and kind of maintaining that particular list, as well as the methodology in which we are communicating. And that can take a number of different forms. That could be something, and I think for those involved in typical public health preparedness and response activities, this would seem fairly straightforward. But when we think of responding to events, whether it was some of the drinking water challenges that we've had recently, or even throughout COVID, or other public health challenges, we are constantly thinking through who needs to be at the table, who needs to be involved, and how do we engage with them? Are we doing meetings? Are we having emails with situational reports? Are we doing web conferencing like we're doing for the training here, or electronic messaging? And that is another capability or way that we exchange information, and that does actually take much more of a focus in functions 2 and 3. And then finally, for this particular function, having procedures in place, right? So having something in writing that kind of documents how will we review the information sharing needs, how will we work on updating who needs to be at the table, and kind of having that sort of at the forefront of some of our planning and procedures for public health emergency response. Function 2, identify and develop guidance, standards, and systems of information exchange. So we are going to start to kind of move in the direction of electronic exchanging of information. So it will get a little bit more technical for functions 2 and 3. However, I think a lot of the concepts here would still apply in any type of information exchange process. So the technical piece here, I think you will find applies more to things like electronic lab reporting and how we receive those labs from facilities and process them into, a system like VEDS, our Virginia Electronic Disease Surveillance System. But you may have sort of hybrid situations like VHAS, where you're trying to collect information into a single system, manage users to this system. But I think some of this would also apply to other more conventional means of information sharing, like a SIT-rep document that you send by email. The tasks for this, as they're laid out, kind of initially identify relevant regulations, policies, and standards that would kind of inform our information sharing, identify any data requirements from the stakeholder as part of that exchange, determine conditions or triggers for exchanging the information, looking at developing a system for data storage as part of that exchange process, and then kind of from a quality control perspective, identify and mitigate barriers to exchanging information. Within our field, certainly there are policies, regulations, commitments, grant requirements, et cetera, that all may kind of impact what we are required to do from a data sharing or information sharing perspective. So researching those or having a good handle on what those are, what applies. Certainly our VDH confidentiality policy would speak to a lot of this as well in terms of limits or how to protect our the information that we do exchange, as well as anything that would be sort of like OIM security standards as well. I think MOUs would fall into this as well. Do you need or are there existing memorandums of understanding with stakeholders as it relates to agreeing upon sharing information? Moving to more of the data requirements for some of our information systems. Again, the electronic messaging, we do have certain data requirements, both in the data that we receive and also the method in which we receive it. So understanding or having those agreed upon and spelled out as part of that process, but walking the data requirements back to a more conventional sense, identifying what would be considered essential elements of information, I think is kind of foundational to any kind of information sharing approach that you have. So really clarifying those, and I think OEP, the Office of Emergency Preparedness, has done a really good job. Jonathan Kaiser and Chris Patterson, especially in some of our more recent responses, in identifying those essential elements of information and including those in like a SIT-rep report and pushing that up to the governor's office. Determining the conditions for information exchange. These are what I would consider to be, like, from a planning perspective, like what are the triggers for, when and to what extent do we exchange information, to which stakeholders as a situation initially begins, escalates, and kind of ramps up, and what are the procedures and having those in place to adhere to any kind of standards as it relates more to the health information exchange electronically. Again, moving more into the technical piece, I think we do from a health information exchange like VEDS or Essence, or even VHAS and VOS, which are all different systems in which we collect information, identifying, maintaining, developing those electronic databases. Of course, I think from a conventional sense, in terms of, I wouldn't say non-electronic, but I think if we have sit reps, right, thinking about teams, team channels, kind of how we allow or store and manage the data that we are collecting, whether it's in more of a situation report like Word document or in an actual sort of like SQL data table in a database somewhere. And for some of these programs, we do have national data standards and being able to be interoperable with sharing information to CDC, other federal organizations, as well as being able to connect with state and private sector organizations. So as we kind of work through all of the processes for information exchange, there is still this underlying task of being able to identify, mitigate, work through barriers that come up, and thinking about that kind of continuous quality improvement process, identifying corrective actions and trying to work through them, mitigate them, whether they are technical in nature, and that may involve working with partners within the agency, OIM, or maybe even VITA, or if they are more legal, and again, working through the commissioner's office or maybe with the attorney general's office, et cetera, to kind of lay the groundwork for smoother information exchange. And I think there's an element here too, where in those times where we're not actively responding, continuing to put in place strategies for collaboration, system integration, and improvements while we're not under the pressure of a response, and building those relationships to continue to improve how we exchange information. Function 3, this is our last function, looking to, ultimately, it is sort of like the data to action, right? Like as we work through exchanging the information and all the elements there, once we have the information, how do we bring the information into a way where we can create a common operating picture and do it in a way where we're able to share that picture with our stakeholders. So first task is obviously exchanging the health information. And then from there, once we have that information or those data, maintaining accessible data repositories, ways to access those data, applying data security protocols, verifying data authenticity, and acknowledgement of the receipt of information. So kind of completing the picture of exchanging information. There is, I think, in terms of exchange health information, again, from my perspective, looking at it from more of the technical data IT informatics perspective, right? The idea of how do we request, send, and receive relevant packets of data between entities, and having everything in place with our stakeholders, whether those are hospitals or labs, et cetera, through this process. Again, I think anyone that's gone through the PPHR, Project Public Health Ready process, or has been involved in a lot of the PHEP planning, knows that documentation in a lot of these instances is very key. So there is a focus again on having procedures in place, documented procedures, not just someone knows how something's supposed to be done. For exchanging information, whether it's with fusion centers, again, some of our state or federal partners, as well as local partners, healthcare entities, et cetera. and there's a whole host of different health information exchanges that go on. I kind of alluded to that a little bit, whether it's case reporting, lab reporting, syndromic surveillance, which involves emergency department or urgent care health information exchanges, our vital records, death registration systems, immunization information. There's a whole host to kind of unpack as part of this information sharing perspective. And I think as we collect and have a lot of these data across multiple different categories, having data sharing agreements and kind of having that process smooth is another component, which is kind of enters into more of our data governance within the agency. Maintaining accessible data repositories. Again, to me, if you have data or information sitting somewhere and people can't access it and you're not effectively being able to share it out there, then you can't really prompt people to take action. So from a surveillance perspective, we're constantly thinking about how you go from data to action. And part of that is making sure that it is accessible and easily interpretable in order for people to make informed decisions and then take actions on those. I would be remiss to not mention, of course, that we do have VITA and OIM consulting and providing security protocols and sort of best practices as it relates to keeping all of our information secure. So making sure that we are following those and applying those, whether it's through more conventional means, meetings, emails, etc., or if it's more of the technical health information exchanges where we're getting laboratory electronic records or emergency department information, and applying those to the databases and the processes in which we use to gather and store those data points. I think there's also, as we work through that a little bit, having secondary systems. I know with some of our recent IT security audits, having redundancy or backup plans is a big talking point within that space. And so again, thinking through from a preparedness perspective, having secondary systems to allow for continued uninterrupted information sharing needs to be part of our planning and considerations. The last two, verifying data authenticity as well as acknowledging the receipt of information. I think that's just, again, whether it's conventional or technical, it's kind of working through, the process of how do we acknowledge that, the information that we are receiving is coming from the sources that we expect it to come from, as well as the people who are receiving our information are the ones that should be actually receiving the information, and thinking through security processes or verification steps, and then also being able to say, like, yes, we have received this information, to kind of close that communication process altogether. So that does conclude kind of a walkthrough of the Public Health Emergency Preparedness Capability 6 information sharing. And I recognize that it is a little bit technical because it does apply to a lot of the different electronic messaging streams that we do manage at VDH. However, I will stop sharing my slides. And I think, Donald, at this point, if there are questions, I'm happy to take those.
Yes, thank you, Jonathan. This was a great presentation. Are there any questions or comments for Jonathan? Well, if there are no questions or comments, this concludes the May EP&R Lunch and Learn. And again, thank you, Jonathan, for taking time out of your busy schedule to do this wonderful presentation. And we'll see everyone next month for the June EP&R Lunch and Learn. Thank you and have a good day, everyone.
All right. Thank you, Donald.